Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. Well, last Saturday, November 7th, was a very big day for the House of Representatives. After months of wrangling over health care reform, they finally approved a bill, and now we have to figure out what does it all mean for us. So I'm here with Trudy Lieberman, who is the director of the Health and Medicine Reporting Program in the Graduate School of Journalism at City University of New York. She's also a contributing editor to the Columbia Journalism Review and a health blogger for CJR.org. Welcome.
Thank you. It's good to be here.
Trudy, help us. What does it all mean?
Okay, we'll try to boil it down very simply. The bill would require every American to carry health insurance. And that means that if you don't have health insurance provided by your employer, or you're not in Medicare or Medicaid or some other kind of public program, you will have to go out and buy health insurance.
So the first of the four big things that healthcare reform is supposed to do. One is we've got 46 million people, they're not insured, how can we get them covered? And this is one of the solutions.
Well, this will be a partial solution. Not everybody will be covered even with this expansion. There will be exemptions. Certain immigrant groups will not be included. And I think that we are seeing that we will not reach 46 million people covered. There will be something less.
How many people do we really think are going to be covered? I'm hearing 36 million is the number I'm hearing.
36 or 29, depending on whether you think about the House bill or the Senate Finance Committee bill. And I think because we really don't know yet, it's going to be determined in the conference committee at the end. And in order to do that, because it's very expensive, the average price of a family policy is over $13,000. The government will institute a series of subsidies, credits, affordable credits, that will help people buy the coverage. And we really don't know yet where those credits will be set and how helpful they will ultimately be to different people. What people need to understand is there's another little wrinkle in all of this, that in order to cover all these sick people, insurance companies still are going to have to do their underwriting in some way. And underwriting is a wonky term, which means that they are going to select out the people who aren't likely to file a lot of claims. In other words, healthy people. So
they're going to try to get that.
So the way they're going to do this is to do it through the rate, and they're going to do something that's called age rating. And age rating means that they will charge older people more money for the same policy that they charge a younger person. And in the House bill, they can charge an older person 2 times more, and in the Senate Finance Committee, they can charge 4 times more. So a lot of people think they may compromise somewhere in the middle, and that say a person 55 or 58 will pay 3 or 4 times more than a younger person.
But isn't that really charging them for a pre-existing condition, which happens to be being aged, right?
Exactly.
Being old happens to be the pre-existing condition.
Older people are likely to be sick,
right.
And a lot of people feel that this is called underwriting through the back door, and that the age rating is simply a proxy for what they were doing before.
Well, this is a nice segue to point number 2. Point number 2 was to say that there were certain insurance industry reforms that people wanted to talk about. One was that you can't jack up rates on people if they get sick. And 2 is you can't say if you have a pre-existing condition, we're not going to sell you insurance. So that now is forbidden in this House bill, right?
Right, but we don't know what other little details will modify that.
How about the third thing? The third thing was, look at all this waste. I mean, in a new system, true healthcare reform, are we just going to figure out a new way to pay for the old system that doesn't work and which has a lot of waste? $2.5 trillion a year in healthcare costs. 500 billion of it is felt to be wasted. What does this bill do for that?
Well, there's clearly a lot of waste in the American system, and I think it's really problematic whether this bill or any bill is going to weed out all of that waste. I think it's good to remember that what some people might consider waste is another person's income. And our system is very profit-driven, unlike many of the other systems in the world. And people whose incomes will be affected by this are going to scream, and they're going to be screaming to the U.S. Senate. And so we really...
Well, who are those people whose incomes are going to be affected?
Doctors, hospitals, drug companies, biotech companies. There's a whole lot of stakeholders all up and down the line. And I think we're going to see a lot of lobbying going on in the next month or so. But I think as far as really weeding out the waste, I think there's some things that these bills do that will try to get at that, like perhaps change the incentives for doctors and the way some doctors are paid.
How do you change? What does that mean for real? I mean, for example, angioplasty, which is a procedure which opens up clogged arteries in the heart. 30% of them of those angioplasties are felt to be unnecessary, and yet doctors do it.
Well, because it's lucrative to do it, and I think that what's contemplated is an agency that would help doctors decide what the evidence is and whether they should be doing all these angioplasties on every single patient.
So this is comparative effectiveness.
Right,
We've
they're
heard
going to
these
try to
evidence-based
rationalize
medicine.
the care a little bit and do what works.
How about the fourth, which is prevention? What does it do for prevention?
The House bill provides for grants to employers to set up some wellness programs. We're not sure exactly what is in the Senate bill yet. So it's an open question what kind of incentives will be built in the final bill to deal with wellness programs and that sort of thing.
What are people really upset about?
Right now, I think they're upset about the abortion issue, which suddenly got injected into this debate at the 11th hour.
And it's very complicated, right, in terms of...
Yeah, it's quite complicated, but the gist of it is that people who are getting the subsidies to buy these insurance policies can't use those subsidies to buy policy that covers abortions. That is it in a nutshell.
And there's already federal legislation that says you can't use federal funds for abortion, right?
Correct.
What else is another hot button issue?
Well, coverage for illegal immigrants, but they are not going to be covered in any of these bills. And so then that raises the question about where they're going to get their care and whether they will still be using emergency rooms and all of that argument. So that is still a simmering issue at the base of this whole thing.
But they won't get subsidies, but if they want to buy, they can buy insurance, right?
On the open market. It's
Right.
a question whether they can buy through the exchange.
Right, but then they certainly don't get any subsidies.
Right, absolutely
Okay.
no subsidies.
So that's a hot issue. What else?
I think the level of affordability. I think you're going to see a lot of back and forth about what those percentages are that people will have to pay out of their own pocket. Should it be 10%? Should it be 12%? Should it be 5%? And I think you're also going to see a lot of discussion around what the penalty should be. If people don't buy health insurance, they have to pay a penalty. And right now the penalties are pretty low. The Senate bill penalty will go up to $750 at some time in the future, graduated from like $200 all the way up to $750. So for people, it might be much cheaper just taking the penalty than buying a $13,000 policy.
Well, we'll have to wait and see what happens in the weeks to come. Thank you so much to Trudy Lieberman for her expertise. I'm Dr. Jon LaPook for CBSDoc.com. Good day and good health.